In this video, I am going to explain in detail about the Cobb's angle. Coming to the introduction, the Cobb's angle is the most widely used measurement for quantifying the spinal curvature. The Cobb's angle is a measurement of side-to-side spinal curvature, which is a deformity which you may know as scoliosis. A Cobb's angle describes the maximum distance from straight a scoliotic curve may be. Coming to the history, Dr. John Cobb was an American orthopedic surgeon who invented this method in 1948. The Cobb's angle was formally adopted as the standard quantification of scoliosis by the Scoliosis Research Society, which was founded in 1966. Coming to the measurement, to get your Cobb's angle measured, you will need to have an X-ray taken. This generally requires to be in a standing position. Both your lateral and anteroposterior views are taken. After that, then the examiner views the films and locates the most affected vertebrae in the curve. That is known as apical vertebrae. So the most affected vertebrae in the scoliotic curve is known as your apical vertebrae. So apical vertebrae is in a scoliotic curve is the spinal bone or a vertebrae with the greatest degree of rotation, and it is also having the least amount of tilt. So it is the vertebrae which is the most deviated from the normal spinal curvature. So that is known as your apex or apical vertebrae of the scoliotic curve. Next step is to identify your upper and lowermost vertebrae of the scoliotic curve. So this is the next step, that is the identification of upper and lower vertebrae. So these two vertebrae, upper and lowermost vertebrae, will be having the greater amount of tilt and least amount of rotation and displacements. So they are located above and below the apical vertebrae respectively. So to interpret your X-rays, a line is drawn along the edge of the upper and lower vertebrae of the curve. So a line is drawn on the upper end plate of the upper vertebrae and lower end plate of the lower vertebrae. And these lines are extended out. So these lines will be extended out and they will be forming and they will be merging at a point. So that point is almost in line with your apical vertebrae, and these two lines will be forming an angle that is known as your Cobb's angle. So these two lines meet to form an angle at the level of your apical vertebrae, as I told earlier. So the Cobb's angle is found by measuring the angle of these two intersecting lines. So in other words, we can say that the curvature of the Cobb method is defined as the angle between the upper border of the upper vertebrae and the lower border of the lowermost vertebrae. So which is the angle between the two lines drawn perpendicular to the upper end plate of the uppermost vertebrae and the lower end plate of the lowermost vertebrae. So coming to the interpretation. So a Cobb's angle, that is normal 0 to 10 degrees your normal spinal curvature, and a Cobb's angle in the range of 10 to 20 degrees is considered as mild scoliosis or mild scoliotic curve, and scoliosis severity is moderate when the Cobb's angle ranges from 20 to 40 degrees, and a Cobb's angle greater than 40 degree denotes a severe scoliosis. Coming to the uses, the Cobb's angle is used as a standard measurement to determine and track the progression of scoliosis. The Cobb's angle measurement is a commonly used quantification method to assess the severity of scoliosis, and it also aids in kyphosis or lordosis assessment in the sagittal plane. Coming to the limitations, first limitation is your intra-observer and inter-observer variations. That will be at least 5 to 10 degrees of variations can be present. And next limitation is your rotation. Minor rotation of patients between examinations can significantly change the measurements, may high as 20 degree variations. So in order to prevent that, consistent positioning must therefore be obtained. Third limitation is your diurnal variation. So in the same patient on the same day, curvature increases during the daytime. So that is nearly 5 degrees of variations can be seen. And next limitation, the Cobb's angle measurement results may vary due to the patient's body position during the X-ray and the skill level of the medical surveyors, with an error range of typically 3 to 5 degrees. So these are the limitations of differences which you can see in the Cobb's angle measurements. So by this, I'm concluding this video. Thank you for watching this video. Please do share and subscribe this video to your physio friends and fraternity. Thank you.